Hi, my name is Miriam Baranchek, and this is my microbiology disease report on chickenpox. So before we talk about chickenpox, we need to know a little bit about its taxonomy. It is a member of the superkingdom viruses, phylum Peploviricata, class Hervivicales, order Herpes viralis, family Herpes viridae, subfamily Alpha Herpes virinae, genus Varicella-virus. The ICTV name for chickenpox is human alpha herpes virus 3, and its common name is varicella zoster virus. Some other important viruses to know that are related and in the same family as chickenpox are the herpes simplex viruses, such as that would give you like cold sores, and your Epstein-Barr virus, which can cause lymphoma and leukemia. So the structure of your chickenpox virus, it is a linear double-stranded DNA genome that is encased in an icosahedral nucleocapsid and coated by a lipid envelope that contains glycoproteins. These glycoproteins are crucial in the way that it infects your cells. The virus itself is approximately 80 to 120 nanometers in diameter, and this virus only infects humans, and there are no zoonotic reservoirs that we know of. So the history of the chickenpox virus, it most likely originated in Africa millions of years ago, and there is recorded cases of chickenpox throughout the ages, although it was considered to be smallpox until 1777, when William Heberden differentiated it from smallpox. Now, in 1888, von Bocquet connected chickenpox to shingles. He did this by observing that somebody who came into contact with an infected shingles victim themselves contracted chickenpox, even though they had never had it before or been exposed to it before. Now, in 1954, work began to develop a vaccine against chickenpox. This vaccine took 20 years before it was fully licensed and developed and entered use in the US and in Europe. For symptoms of chickenpox are most commonly fever, tiredness or malaise or fatigue, loss of appetite, headache, and the characteristic rash. This rash usually develops about 1 to 2 days after the other symptoms and is the means by which chickenpox is most often diagnosed by doctors. The chickenpox rash, so we need to talk about this a little bit more since it is the characteristic way that chickenpox is diagnosed. It occurs usually 10 to 21 days after you are exposed to chickenpox virus. And the rash, once it manifests, it typically persists for about 5 to 10 days. So there are 3 phases of this rash. The first phase that you will notice is papules, which usually occur over several days, and they're just little red bumps under the skin. Then eventually it will, over the course of a day, develop into vesicles, which are fluid-filled blisters. Now, these blisters will pop and release their fluid and then crust over and scab. Then the scabbing is usually about in a couple days again. You can actually have all 3 phases of this rash at once occurring, as you see in the picture up above. And they will occur simultaneously. Now, for transmission of the chickenpox virus, the primary method that we see for transmission is direct contact person to person. This would involve contact with the vesicular fluid that was released from the vesicles, or via respiratory droplets. So this would also be if somebody rubbed their nose or their mouth and then rub their nose or their mouth, and then somebody came into direct contact with that saliva or vesicular fluid. You can also have herpes, have chickenpox virus transmitted airborne via aerosolized droplets. This is one of the only herpes viruses that can be transmitted airborne. This is because the virus is smaller than other herpes viruses, so it is able to be transmitted via those aerosolized droplets. So it can also be transmitted via indirect contact. Would be in via objects contaminated with vesicular fluid or respiratory droplets. An example of this would be the notorious chickenpox lollipop, where somebody would lick that lollipop who has chickenpox, and then another person who is not infected would also lick the same lollipop and would contract the chickenpox virus. Hosts of chickenpox virus are contagious for 48 hours before the rashes form until all the blisters have scabbed over. This is dangerous since somebody may not necessarily know that they are feeling ill because they don't have the chickenpox rash, and other people will come into contact with them and contract chickenpox. So the varicella zoster virus will remain viable outside of a host for up to 1 day. How does chickenpox cause disease? So the chickenpox virus is inoculated at the mucosal membranes. So this would be your mouth or your nose. It will go into your tonsils and infect your CD4 positive T cells. It then spreads to your lymph nodes in your lymphatic system, and then through the lymphatic system arrives at the liver and spleen, where it will incubate for 14 days. Then the T cells will re-enter the bloodstream and travel via the bloodstream to your skin and epidermal cells, where the replication will occur in your hair follicles. The viral particles then are released in the vesicular fluid, which has formed from the virus replicating and causing that characteristic rash that we see with chickenpox. So the viral particles then are released in that fluid and in your respiratory secretions and are then able to go on and infect other hosts. So your chickenpox virus may actually establish latency in your sensory nerve ganglia cells or in your extramedullary cranial ganglia. The exact cause of reactivation into the shingles virus is not known at this time, but there is ongoing research into why this happens. So prevention. There is a vaccine for chickenpox that is highly effective and widely administered in the United States. This vaccine is derived from the Oka strain of the virus, which is a very mild form of chickenpox virus. The vaccine is a live attenuated vaccine, so it is actually a live virus that you are giving this person. It is given in 2 doses, since 1 dose is deemed not to be fully effective. Once the 2 doses are given, however, it is a very effective vaccine. The vaccine is available in Europe. However, the European health authorities do not recommend it in most places in Europe. This is due to concerns that vaccinating will result in more cases in older individuals, since there will be religious exemptions given to some people. And since the wide population is vaccinated, those individuals who are not vaccinated will not encounter the chickenpox virus in their lives until later in life. And at this point, they are more likely to develop serious symptoms, since they will be more immunocompromised and more likely to have long-term implications from contracting chickenpox. So in Europe, only high-risk individuals or children are generally vaccinated. However, if you know that you have been exposed, there is an antibody therapy that is administered within 96 hours of exposure in people who are at higher risk and have know that they have been exposed. This antibody therapy is good at reducing the severity of the symptoms. However, it does not completely prevent those symptoms from forming in most cases. So, diagnosis and treatment. Chickenpox is usually diagnosed by the characteristic rash. However, there are other methods of diagnosing, such as viral isolation and antibody tests. But however, these antibody tests are intended to determine whether or not somebody is immune and has had chickenpox in the past. They aren't able to differentiate whether or not that person has chickenpox currently. And there are no true cures for chickenpox at this time. There is, like I mentioned earlier, the varicella-zoster immunoglobulin or antibody therapy that lessens the severity of the symptoms by giving a person who currently has chickenpox the antibodies from somebody who has recovered from chickenpox. There are also antivirals that can be used in special circumstances, such as the immunocompromised or elderly. Some examples of these antivirals are acyclovir and adenine arabinoside. So just to wrap up, the best way to prevent chickenpox is by receiving the vaccine and just limiting your exposure. So don't go to chickenpox parties, since the chickenpox is still a very severe virus and can have long-term implications and effects on people who do not get the vaccine and encounter it in daily life. So thank you so much for listening to my presentation, and here are the references that I have used. Thank you so much.